Plasma therapy, which was touted as one of the viable therapeutic options against coronavirus disease, is no longer recommended as a treatment. According to the AIIMS ICMR COVID-19 National Task Force and the Union Health Ministry, the off-label use of convalescent plasma therapy has been dropped from the COVID-19 treatment protocol for adult patients.
Serves as the pinnacle of evidence. We call it like the topmost evidence, and that is not supporting any role of plasma therapy in a kind of keeping situation.
The sudden decision has put the social groups and patients in a bit of a limbo there. Why was it dropped then? Scientists now believe that plasma therapy can't be used for the treatment of COVID-19 patients. They've said plasma therapy wasn't found beneficial in reducing the progression to severe disease or death. Simply put, there is no difference in COVID-related deaths due to plasma therapy. Several experts also have said the use of such plasma may have even played a role in facilitating new worrisome mutations to this virus. In fact, it raised the possibility of developing more virulent strains because of its irrational and non-stop use. In spite of no evidence that plasma therapy reduces mortality or improves patient outcomes, doctors have often put the onus on caregivers to source such plasma from recovered patients. This has often led to unnecessary anxiety, panic and harassment.
If something does not work, but still there is continuity in terms of false hope, then there will be unnecessary anxiety, spending of money, harassment and all of that.
So what really is plasma therapy? When pathogens attack, the body's immune system creates proteins called antibodies to fight off the infection. Plasma, which is the liquid part of the blood of those people who have recovered from COVID-19, has antibodies developed against the virus. These antibodies are given to the infected person in order to transfer the immunity of the healthy person. The process is called plasma therapy. The process of donating plasma blood is similar to donating blood and takes about an hour or so. The previous guidelines had suggested the use of plasma therapy for patients with moderate infections or within 7 days of the onset of the infection, and if a donor with high concentration of plasma was available. It clearly mentioned the therapy had no use after 7 days.
If somebody is having a little bit of fever and cough, and we know that the home-based isolation and care helps most of the people, and so in order to give plasma, although these people are in early stage of the disease, we tell them that, look here, come get admitted to the hospital so that I can give you plasma, spend money, not knowing what he or she is getting. And how many rural settings do we have where you will measure the antibody concentration?
Moreover, doctors say the antibodies in plasma need to be in sufficient numbers, and that was not being ensured. According to ICMR scientist Dr. Samir and Panda, plasma therapy had to be administered in a hospital, which means hospitalization. That means adding to an already overworked healthcare system.